there were quite a few things that got my interest, and as usual in EASL meetings, there have been lots of very good presentations, but I have to select some from a clinician treating liver cancer. We've seen for the first time real live reports on the use of the drugs that have been introduced in the field over the last couple of years. So there are drugs like lenvatinib or nivolumab or other cabozantinib and other TKIs, regorafenib. And we had the data coming from the pivotal clinical trials regarding the efficacy and the safety of these agents. But it is important to learn in real life scenarios whether the toxicity profiles are similar, whether you can expand the indications to patients with more advanced liver disease, not so well compensated, maybe patients that are not fit because of comorbidities or other reasons to enter the clinical trials. And we've been presented with a number of these real life reports. And basically, I'm not going to go into details of each and every agent, but basically what these reports have told us is that both the safety and the efficacy are confirmed in these real life scenarios. And we've started to see that there is a chance of combining or sequencing the treatments one after the other. And this is a field that will be very important for future research. And if I would like to highlight one specific important piece of information that we've learned in this regard, I would highlight the report of a clinical trial that for the first time targeted the population of child B patients. So child B patients with slightly decompensated liver cirrhosis, mild ascites, not too good synthetic liver function, are always excluded from clinical trials. There was a clinical trial that was specifically targeting this population, and with the drug nivolumab, which is an immune-stimulating antibody. And what the trial showed very clearly is first that the safety profile was the same as in non-decompensated, better liver function preserved patients. So first important point is safe to use the drug in this population. And second, that the efficacy is also maintained. So those patients that achieve a good response are able to maintain the preserved liver function, relatively preserved over a long period of time, and this translates into very good survival data. So these real life scenarios, I think, are something that is important. A second point that was really capturing my mind was related to the use of a biomarker that is alpha-fetoprotein. In 30 years ago, we used this biomarker for screening patients with cirrhosis for the appearance of early tumors, but we did fail in getting a lot of patients into curative therapy by using this biomarker, because the cirrhotic liver quite frequently produces low levels of alpha-fetoprotein in the regeneration process that is part of the cirrhotic status. And accordingly, the EASL guidelines do not recommend specifically the use of alpha-fetoprotein for screening purposes. They only recommend ultrasound examination. But now the perspective has changed, because for the out of the three more frequent etiologies of liver cancer, hepatitis C, hepatitis B infection, and alcohol, for hepatitis C and hepatitis B, now we have therapies that it can either cure the disease and eradicate the infection, or put the infection under control. And when this occurs, there is no more liver damage, there is no more need to regenerate. So we've seen is that the production of alpha-fetoprotein drops. And so in the situation of lack of baseline increased levels of alpha-fetoprotein, the use of alpha-fetoprotein as a screening marker could be useful. And there was a nice presentation by a group from Spain, indeed showing that in a screening program that is very active for these hepatitis C cured patients, alpha-fetoprotein could indeed be a valuable thing. We have to confirm this in more screening programs, but this is also an important thing. And if I would have to choose a third thing that really captured my mind was some insights we now have, because reports that were presented here into subpopulations of very difficult to treat tumors, which are the mixed hepatocholangiocarcinoma. So these tumors are tumors that we usually diagnose at a later stage and have a poor prognosis. There was a very interesting report showing how the genomic background of these tumors is enriched in stem cell-like features. And these stem cell-like features provide usually tumors with a very treatment-resistant phenotype. And this is really what occurs, what we see in clinical practice. And in this report, the group was able to mimic what happens in humans in animal models. And by using these animal models, they were able to identify what are the drivers of these phenotype. And this provides a potential target for future developments of effective therapies.